Welcome to the second Ryan White Planning Council public hearing for 2024. This public hearing was pre-recorded online through Zoom. If you'd like a copy of the information being presented this evening, you can view and download the documents from our website at rwpchouston.org. I am Ryan Rose, Vice Chair of the Affected Community Committee of the Ryan White Planning Council. Also with us this evening is the 2024 Chair of the Ryan White Planning Council, Josh Micah, Peter Gay Ledbetter, Co-Chair, and Jay Baumick, Vice Chair of Priority and Allocations Committee, and Diane Beck, Council Coordinator in the Planning Council's Office of Support. The focus of tonight's public hearing is the recommended funding allocations for fiscal year 2025, which will begin on March 1st, 2025. But first, there will be a presentation on Project LEAP by Diane Beck, who is one of the facilitators of the program. Afterward, Jay will give an overview of the Priority and Allocations Committee process, followed by Peter, who will present the fiscal year 2025 funding allocations recommendations. The allocations recommendations include level increase and decrease funding scenarios for each grant. Remember that everything discussed here will not affect how services are delivered now, but will impact how services will be delivered approximately 10 months from now in the year 2025. After the presentations, I will explain how you get public comment regarding the information presented. At this time, I would like to turn the meeting over to the Chair of the Planning Council, who will describe the role of the Planning Council and the purpose of this public hearing.
Thank you for that informative introduction. Good evening, everybody. My name is Josh Micah. I use he, him, él pronouns. I am the Chair for the Houston Ryan White Planning Council, and I am pleased to welcome you today to our public hearing. I will briefly describe the history of the Planning Council, what is that we do, and why we're here tonight. The Ryan White program is the largest federal program focused exclusively on providing HIV care for people who don't have sufficient healthcare coverage or financial resources to meet the challenges of living with HIV. Ryan White fills the gaps in care that are not covered by other sources. The Ryan White HIV/AIDS Treatment Extension Act of 2009 was first enacted in 1990 as the Ryan White Care Act and has been amended and reauthorized 4 times in 1996, 2000, 2006, and 2009, adjusting with each reauthorization reauthorization to accommodate new and emerging needs, such as an increase in emphasis on providing life-saving and life-extending medical services for people living with HIV. Ryan White program works with the governmental entities and community-based organizations to provide HIV-related services to more than 500,000 people each year. There are several parts within the Ryan White program, each one designed to meet the needs of different communities and populations affected by HIV. Part A funds are designed to serve our metropolitan areas and are awarded to the chief elected officer, primarily responsible for providing healthcare coverage in geographical area. In the Houston eligible metropolitan area, that person is County Judge Lina Hidalgo. In 2023, Harris County received over $26 million to provide services for people living with HIV in the 6-county area, which includes Harris, Fort Bend, Waller, Liberty, Chambers, and Montgomery counties. In 2007, the state asked the Houston Ryan White Planning Council to make recommendations for Part B and state services funds. Part B funds are awarded directly to the state of Texas and are used to provide care for people living with HIV in a 10-county area, which includes the 6 counties named previously, plus Austin, Colorado, Walker, and Warren counties. Again, Congress requires that most of those funds to be used to provide medical services for people living with HIV in the 10-county area. Currently, approximately half of 31,000 people living with HIV in our area are using Ryan White funded services. By law, the council is responsible for determining the number of individuals in our area who are living with HIV, assessing the needs of the HIV community, establishing a comprehensive service plan, setting services and priorities and allocation funds, assuring that there's sufficient services to meet the future needs of the changing epidemic, assuring the appropriate services are available to meet the needs of the unserved and underserved women, infants, children, and youth. Ensuring access to services for those who have substance abuse treatment needs, and assessing the administrative mechanism which produces services and distributes funds. The Planning Council falls under the Texas Open Meetings Act, and its proceeds are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. The council is currently holding meetings in a hybrid format, which gives you the opportunity to attend in person or virtually. The council meets on the second Thursday of every month at noon. For more information, call the Office of Support at 832-927-7926 or visit the website at rwpchouston.org. This information will be reprinted to you at the end of the program. It is important to remember that the Ryan White are funds of last resort, which means that all other resources for an individual must be exhausted or unavailable before Ryan White funds can be used. For example, a person must use their private insurance, Medicaid, or Medicare benefits before they're eligible for Ryan White monies to pay for primary medical care. There is also income eligibility requirements that govern the use of Ryan White funds. Many of the services that we provide have an income cap of 300% of the current federal poverty guidelines, which means that an individual with a yearly income of $45,180 or less will be eligible for assistance, provided that all other avenues of coverage have been exhausted. The same guidelines apply for a single parent with one child, would be $61,320 or less. The service category allocations will be reviewing this evening include funds from the Ryan White Part A Minority AIDS Initiative, referred to as AMI, and Part B services and the Texas Department of State Health Services. For examples of the services which Ryan White programs are allowed to provide include outpatient primary medical care, outpatient primary medical care, medications or healthcare, mental health care services, assistance to pay for health insurance premiums, and copay deductibles. For the purpose of this hearing, it is to inform the community about the recommended services, funding allocations for the fiscal year 2025 in order to get feedback from consumers of the Ryan White funded services and others as to how the recommended changes will affect their ability to receive medical care and supportive services. Community input is not only necessary, it is vital to all planning council procedures, and it is encouraged at every level. At this time, I would like to use our next speaker, Diane Beck, Council Coordinator for the Houston Ryan White Office of Support. She will present information about the Planning Council's training program, Project LEAP.
Thank you, Josh. Hello, everyone. I want to talk with you about an educational opportunity for people who want to learn about the HIV prevention and care system in the greater Houston area. The program is called Project LEAP, which stands for Learning, Empowerment, Advocacy, and Participation. Project LEAP is for people living with or affected by HIV. Classes start at the end of July, and the program is free, with the expectation that students participate in one class a week for 17 weeks, and they come to class prepared to listen and engage with the presenters and with one another. Project LEAP is unique to Houston and is only offered to 30 students once a year. The goal of the program is to provide skills so that the graduates use these skills to become effective and active participants in local HIV planning groups, such as the Ryan White Planning Council or the Houston HIV Prevention Community Planning Group. Graduates help shape the future of HIV services in our community. Project LEAP was created because local planning groups need people living with HIV and others who are not afraid to speak up and advocate for the needs of consumers. After graduation, students feel more knowledgeable and confident as they work with doctors, social workers, consumers, and others to design services. If you are a person living with HIV, or you have a friend or family member that is challenged by HIV, you are a perfect candidate for the class. How does Project LEAP work? Classes are held on Wednesdays for 17 weeks with approximately 30 students in each class. The classes last about 4 hours and includes hands-on activities, group projects, and field trips. Lunch is also provided. Guest speakers are experts in their field and enjoy sharing new and updated information with the students. What will you learn? As you can see from the long list here, some of the topics covered in class include HIV 101, the history of HIV in the Houston area, tools for designing and funding services, leadership training, and much, much more. Class participants learn valuable skills, including meeting facilitation and Robert's Rules of Order. Don't worry if you don't know what that is, we will teach you. You will also learn presentation skills, how to read and understand data, planning and evaluation skills, advocacy, and cultural competency. The facilitators provide information and handouts for each class. We have mock meetings with role playing. We bring in expert speakers. There are hands-on activities, class projects, and field trips to see what planning groups do when they meet. Those eligible to apply for Project LEAP are people who are living with HIV or are affected by HIV personally or professionally, and who can meet the class expectations in terms of attendance and participation. So what do you get out of Project LEAP? You get knowledge and skills that help you to advocate for your health as well as the health of others. You get an extensive binder of information with easy to read materials about HIV. And you get access to experts and mentors, as well as some new friends who share your passion and concern for the issue. Most of all, you get the opportunity to make a difference for people living with HIV. So how do you apply to be a LEAP student? You must submit a written application before July 12th. We will call and set up an interview, which can be in person or virtual depending upon your comfort level. The classes will be hybrid, so students can choose if they wish to participate in person or virtually. The class will begin in early August and end in mid-November. To find out more information or to apply, you can go to our website, rwpchouston.org, where you'll find a link to apply online, or you can call or send an email for a paper application. This contact information will be repeated for you at the end of the public hearing. We would love to hear from you. At this time, please turn your attention to the Vice Chair and Co-Chair of the Priority and Allocations Committee, Jay Bahamick and Peter Gay Ledbetter, who will explain the committee's process and their service category funding recommendations for 2025.
Thank you for the valuable information, Diane. Many current and former council members are graduates of Project LEAP and would agree that the training is very valuable for those who want to be involved in the planning process. Speaking of the planning process for HIV services, each year in April and May, the Quality Improvement Committee of the Ryan White Planning Council considers many facts when reviewing each of the funded service categories. When changes are made to what is offered through a service, those changes are based upon information such as the documented needs of various populations living with HIV in the greater Houston area, the history of the service usage, epidemiological trends, and the availability of alternative resources, including Ryan White and non-Ryan White funding. Once the service category definitions have been approved, it is time for the Priority and Allocations Committee to prioritize the service categories and allocate the monies to each one. Tonight, we are going to talk about the work of the Priority and the Allocations Committee. The mechanism for awarding Ryan White funds changed in 2014, and we are now seeing southern parts of the US, such as the Houston eligible metropolitan area, receive higher grant awards, while areas like San Francisco and New York are experiencing significant decreases in their award amounts. That is because the South is where the new diagnoses are on the rise. Starting in 2015, the Houston area received an increase every year, except 2, where we got a small decrease. This is good news for the Houston area, but some would say that we have been underfunded for many years, and now we have the opportunity to catch up with a growing number of people needing our services. In addition to our Ryan White grant, Houston also receives the Minority AIDS Initiative, or the MAI funds. The goal of the Minority AIDS Initiative is to address racial and ethnic disparities in HIV-related health outcomes and expand the community-based capacity to serve people of color living with HIV. In recent years, a significant factor in determining the allocation of the funds to individual service categories has been the availability of private health insurance offered through the Affordable Care Act. There are currently over 6,100 clients registered in the Ryan White system that are enrolled in either public or private insurance. The anticipated result is that there will be a reduction in the use of Ryan White funded medical services and an increase in the number of clients needing help through the Ryan White Health Insurance Assistance Program. Another significant factor is the unpredictable application processing time and changes in the eligibility requirements of the Texas HIV medication program, commonly referred to as the ADAP. As you know, access to medications is vitally important, and we are allowed to use local funds to fill this gap when necessary. This year, the recommendations from a special How to Best Meet the Need work group were also considered during the allocation process, specifically services to meet the unique needs of individuals over the age of 50 who are aging with HIV, living with HIV, as well as taking medications to treat HIV can prematurely age the body, resulting in an earlier need for services considered geriatric for the general population. The proposed service category funding allocations to be presented are for the fiscal year 2025, which begins on March 1st, 2025, and includes Ryan White Part A, MAI, Part B, and state services grants. The recommendations for the service priority rankings for 2025 will be determined by the committee at the meeting on July 25th, when the results of the recently completed HIV Care Services Needs Assessment will be available. The proposed service priority rankings will be distributed to the community by email, as well as posted on our website and Facebook page in order to invite public comment prior to being finalized by the Planning Council in August. Because of this, the service category allocations this evening will be presented in alphabetical order. The fiscal year 2025 allocations are based primarily on fiscal year 2023 expenditures, the final allocations for fiscal year 2024, and the anticipated number of clients utilizing Ryan White funding services, including those who enroll in private insurance but need assistance paying premiums, copays, and deductibles. Currently, there are approximately 15,000 people living with HIV, in the Houston area who rely upon Ryan White funds to pay for some or all of their HIV-related medical care. This is approximately half of the people living with HIV in the Houston area. The first 9 service categories are defined by the federal government as core medical services. And the legislation requires that we spend at least 75% of our grant funds on the direct medical care services for Ryan White clients. The remaining 25% can be spent on support services such as transportation to medical equipment, service linkage, and more. The Houston area typically spends 80% of our funds on the core medical services for Ryan White clients. I will now present the first half of the level funding scenario, which assumes we will receive the same amount of funding next year as we did this year. The recommended service category allocations for 2025 level funding scenario are the same as the fiscal year 2024 final allocations unless otherwise noted. Ambulatory outpatient medical care. The proposed allocation for Part A is $11,107,927 plus $2,098,411 in Minority AIDS Initiative funds for a total allocation of $13,206,338 million. Health insurance premium and cost sharing assistance. The proposed allocation for Part A is $1,483,137. For Part B, it is $1,028,438. And for state services, it is $1,167,101 for a total allocation of $3,678,671. Hospice services. The proposed allocation for state services is $259,832. Local pharmacy assistance program. The proposed allocation for Part A is $2,067,104. Medical case management. The proposed allocation for Part A is $2,183,040 plus $318,597 in Minority AIDS Initiative funds for a total allocation of $2,501,637. Medical nutritional therapy. The proposed allocation for Part A is $341,395. Mental health services. The proposed allocation for state services is $300,000. Oral health. The proposed allocation for Part A is $166,404, and the proposed allocation for Part B is $2,410,068 for a total allocation of $2,576,472. Substance use disorder treatment. The proposed allocation for Part A is $25,000. Beta Gay Ledbetter, co-chair of the Priority and Allocations Committee, will now present the remaining recommendations for the level funding scenario, as well as the increase and decrease funding scenarios.
Thank you, Jay. The remaining service categories are defined by the federal government as non-core or supportive services. The recommended allocations for the 2025 level funding scenario are the same as the fiscal year 2024 final allocations, unless otherwise noted. Emergency financial assistance. The proposed Part A allocation for the pharmacy assistance subcategory is $2,039,136. For the other subcategory, which provides one-time short-term emergency food, telephone, and utilities, is $75,000. And the newly added subcategory, which will pay for urgent need, durable medical equipment, is $25,000. Next is the food bank / home delivered meals. The proposed allocation for Part A is $49,500 to provide medically tailored meals for individuals living with HIV and have diabetes, hypertension, or other comorbidities requiring a special prescribed diet. Next is housing. The proposed allocation for Part A is $49,500 to provide temporary, short-term assisted living to individuals living with HIV who are released from the hospital without support at home and unable to care for themselves. Next is linguistic services. The proposed allocation for state services is $68,000. Next is transportation. The proposed allocation for Part A is $374,911. This includes bus passes, van service, and gas vouchers for those living in rural areas. This is a decrease of $50,000 because the supply of bus passes will be replenished this year. Next is non-medical case management. The proposed allocation for Part A is $1,267,002, and the proposed allocation for state services is $250,000, for a total allocation of $1,517,002. This is a $100,000 reduction in state services due to underspending. Now for outreach services, primary care retention and care, the proposed allocation for Part A is $220,000. This is a decrease of $100,000, again due to underspending. The fiscal year 2025 service dollar allocations total $32,647,359 under this level funding scenario. Because the exact amount of Ryan White funds we will receive in 2025 is not yet known, we also have a decreased funding scenario and an increased funding scenario, each of which is designed to best meet the needs of the community under these different circumstances. These funding scenarios are also included in the information packet on our website. So if the Minority AIDS Initiative, or MAI, were to get a decrease in funding next year, 2025, all primary care subcategories would be decreased by the same percentage. This applies to the total amount of MAI service dollars available. If the Minority AIDS Initiative, MAI, were to get an increase in funding next year, all primary care subcategories would be increased by the same percentage. This applies to the total amount of MAI service dollars available. If Part A were to get a decrease in funding next year, all service categories except subcategories geriatric medical case management for veterans, medical case management for youth, outpatient substance abuse treatments, service linkage for youth, and service linkage for newly diagnosed and not in care would be decreased by the same percentage. This applies to the total amount of Part A service dollars available. If Part A were to get an increase in funding next year, allocation of the first $200,000 would be to the Health Insurance Assistance Program, and allocate the next $500,000 to ambulatory / outpatient primary medical care proportionately across all subcategories except vision care, and the Pay for Performance pilot project. Any remaining increase in funds will be allocated by the Ryan White Planning Council. And if Part B and state services were to get a decrease in funding next year, a decrease in funds of any amount will be allocated by the Ryan White Planning Council after the notice of grant award is received. If Part B and state services were to get an increase in funding next year, we'd allocate the first $200,000 to the Health Insurance Assistance Program, allocate the next $200,000 to the Oral Health Untargeted, divided evenly between general oral health and prosthodontics subcategories. Any remaining increase in funds will be allocated by the Ryan White Planning Council after the notice of grant award is received. Many volunteer hours were devoted to this challenging work. We generously thank all of the community members who worked so hard to fine-tune each service category and allocate the funds. Public input is strongly encouraged and is an integral part of this process. The Priorities and Allocations Committee will meet on Thursday, June 27th, to discuss whether the comments provide enough data to justify changing the recommended allocations. I will now turn the floor back over to Ryan, who will explain the process for submitting public comment regarding the information presented at tonight's public hearing.
Thank you, Jay and Peta. And a very special thanks to the Priority and Allocations Committee for their hard work this year. After hearing the information presented this evening, you may want to give public comment to the Planning Council. The Planning Council falls under the Texas Open Meetings Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. There are several options for you to provide public comment to the Planning Council. You are not required to give your name or HIV status to do so. You can email comments to feedback@rwpc@harriscountytx.gov. You can fax comments to 713-431-4880. You can phone in your comments to 832-927-7926, or send your comments through our Facebook page, RWPC Houston. Comments must be received by our office before noon on Wednesday, June 26th, to be forwarded to the Priority and Allocations Committee for review and consideration. The Priority and Allocations Committee will meet at noon on Thursday, June 27th, to review the comments and consider revising their recommendations. Time is running out to apply for Project LEAP 2024, the free training program which looks at the HIV prevention and care system in the greater Houston area. Please visit our website to download an application or submit your application online. Applications are due by July 12th. This is a wonderful learning experience, and I encourage anyone interested in HIV services to apply. If you'd like to send comments to the council, request additional information, or learn about our education classes, such as Project LEAP, you may do so by calling the Office of Support at 832-927-7926, or email feedback@rwpc@harriscountytx.gov.
On behalf of Ryan White Planning Council, we thank you again for participating and have a good evening.